Hello and welcome to Medtalks by Dr. Anita, where we delve deep into meaningful health conversations that inspire, inform, and transform lives. Today, I am deeply honored to bring you a truly special episode. For the first time on our show, we are sharing the courageous journey of a breast cancer survivor. This story is one of resilience, strength, and hope, a journey that many women across the world walk, but few have the courage to share as openly as our guest today. Joining us is the incredible Andrea Maria, a brave soul who faced one of the life's most challenging moments when she was diagnosed with breast cancer. Instead of succumbing to fear, Andrea made the life changing decision to undergo a prophylactic mastectomy, a step taken to safeguard her future. Today, she stands as a beacon of hope for so many others, and she is here to share her powerful journey of battling and overcoming this formidable disease. Supporting Andrea throughout this journey was none other than esteemed Dr. Mohan Rangaswamy, a renowned plastic surgeon known for his expertise and compassionate care in breast reconstruction. Dr. Mohan's remarkable skill and dedication have not only helped restore lives but also renewed the confidence and dignity of his patients. In this conversation, we will explore Andrea's emotional, physical, and psychological journey through diagnosis, surgery, and recovery. We'll hear about her challenges and what kept her going even during the darkest moments. With Dr. Mohan, we will uncover the medical perspective, what it takes to plan and execute such a complex procedure, and why breast reconstruction can play such a pivotal role in the healing process. This episode isn't just about medical procedures, it's about hope, courage, and the unwavering human spirit. Whether you are someone who is battling breast cancer, a family member supporting a loved one, or simply looking for a story that uplifts and inspires, this conversation is for you. So, without further ado, let me welcome Andrea Maria and Dr. Mohan Rangaswamy to Medtalks by Dr. Anita. Thank you, both of you, for being here today. It's such a pleasure, and I'm so
Thank you.
honored.
Thank you for the wonderful opportunity once again.
Once again, yes, absolutely. It's always, it's an excitement to have you on the show because every time
You are
we
very
delve
kind.
deeper into an unexplored world, basically. And thank you so much, Andrea, you as well. I mean, I'm so honored, really. It's a brave step to come on this platform and share your journey. So
Thank you, Dr. Anita, and thank you, Dr. Mohan. My journey is far from over. I'd like to point that out.
touch wood, please.
But and generally, it's very difficult to say that a cancer patient is ever cured. You're just maybe free of cancer at one point, but it's a diagnosis that actually marks you for life. And
Absolutely.
yes, and you need to be very much aware of this, and as we say, always plan, do your checkups, follow any kind of treatment if there's additional treatment to be followed, and then at the slightest thing that might happen to your body that is uncommon
True.
or
People ignore
unnatural,
that.
yes, immediately go to your doctor, speak
Get
to a
it checked.
doctor, and get it checked.
So how did it start, Andrea? Like, what was the beginning? I mean, how you started feeling it, and what were your thoughts about it? How you landed in Dr. Mohan's consultation room?
Can I start my story with before I was born? 1 month
It's up
before
to
I
you.
was
Wherever you
born.
want to start the story, it's your show
Okay.
now.
So 1 month before I was born, my maternal grandmother died of breast cancer. Back then, obviously, we're talking about 46 years ago. So back then, the treatment was limited, the knowledge about cancer was limited, and especially the fact that she lived in a village, so very difficult access to medical care. And then people tend to be very scared to receive a diagnosis. We can talk about this a little bit later, right? So she definitely did not receive the right treatment. By the time that she underwent surgery, it was quite advanced. And again, the follow-up was not the same. So I think that it took her, if I remember correctly from what my mom told me, approximately 3 years for her to actually pass away. But my mom was pregnant.
Suffering.
Yes, my mom was pregnant with me. And it just so happened that for some reason there was in my grandmother was blonde and blue-eyed, and she knew that my mom was going to have a daughter. So she kept praying that God would give my mom, a daughter that is blonde and blue-eyed. So here
The
am I
beautiful you.
afterwards. Yes,
The beautiful you.
approximately one month afterwards, I was born. Now, when I reached 14, my mom started behaving quite weirdly. It was also October, so very similar to this period. My mom was 46 and a half. So she started becoming very jittery, very angry at us. Sometimes she was crying. We didn't really know what was happening, actually. We later found out that obviously she had noticed a lump on her breast that was getting bigger and bigger. But the emotional toll that my grandmother's death had taken on her made her very scared to touch it.
Okay.
Right? There
You want to start
was this
investigating.
common myth: don't disturb it, so it's not going to do anything to you.
True.
So then one morning she goes to her work and she decides to visit the nurse. So the nurse, the minute that she saw her, she told her, "You have a huge cancer lump. I'm going to send you straight to surgery now." So it was so severe. Apparently it was even oozing a little bit that she didn't even want to let my mom go home. So my mom got very scared and she said, "I cannot, I have 3 children, let me go home. And I promise that I'm going to go and see a doctor." So she landed with this beautiful human being, amazing doctor who also had colon cancer in his family. So he knew a very empathetic doctor that finally convinced my mom to have surgery. They full mastectomy. It was also on the right side.
Convincing moms is always difficult,
Yes,
even for diagnostic, investigations and all.
yes. But I think that it's the human quality, because the doctor
As a
didn't give
doctor,
up on her.
yes.
He literally kept her in the hospital. 7 days, my mom tried to escape the hospital. Just
You've
trying
seen
to
these things.
explain
You've
to
seen these
her
Moms are like that. They
how
just try to
this is
ignore.
going, yes, how this is going to be useful for her, how it's not going to repeat the same story that she had with her mother. So she finally underwent surgery. And then one thing that was not really, or people were starting to wake up to it, but it was not really done. He took all of us into his office, but separately. So my sister and I separately, to explain to us about the importance of checkups. Back then, it's true that my sister, by that point, she was already studying in the UK. So she had started to be exposed a little bit to the fact that you need to check yourself up and so on.
That awareness was there.
Yes, but I think that it's the importance of that surgeon that literally took us in, explained to us our mom's diagnosis, explained to us that sometimes it can be connected to genetics, especially in view of what my maternal grandmother had gone through, and that it was important to have regular checkups. And then he took my dad separately and my brother separately to explain the case. Yeah. So I think that humanity, that compassion, like literally won all of us over. So after 6 years, when my mom was back, because this type of disease is contralateral or tends to be contralateral, and that's why in my case it was important that I addressed it within the same surgery. She was actually so relaxed. We went, both of us, because my breasts had started to become a bit lumpy, and she wanted him to examine me. And she literally just told me, "Okay, baby, now you go home because I need to stay and have a surgery." Really. But the difference in the compassion made her, it was night and day from one surgery to the other. And yeah, then she was the regular on tamoxifen, 5 years after each of the surgeries and so on. So, and she survived. But and we're going to come back to this, the humanity of the doctor that treats you and that at the same time educates you, so you know what to look for in the future. I think that it's extremely important.
Absolutely.
So then 30 years afterwards, here am I. So I've been doing my checkups because, as I said, all my life I've had lumpy breasts. And I've I've had cysts biopsied and tested and whatnot. There was never any kind of diagnosis. Okay, so it was not. It didn't look like any kind of a disease of the breast. It's just that they wanted to make sure every time that there was literally nothing hiding, knowing my history.
Right.
So this year, the same. I went to in Europe, and I think that that's an amazingly good practice. As a standard of care, your gynecologist checks your breast, and they can also do an ultrasound on your breasts. And the gynecologist that I've been going to for many, many years, he just told me, you have so many lumps now. I said, I know, but we've tested them 2 years ago. They had nothing. And so he went to his desk, and I'll forever remember his face, because he went, yes, yeah, I see that, and he says that it might just be that, you're at that time of your period and probably it's a lot of lumps. But he says, I cannot really see whether there's something happening underneath.
Exactly.
So why don't you go and do either an MRI or a mammogram, and then we'll take it from there.
So what was the previous investigation you used to do on regular basis?
So in Europe, every time that you go to a gynecologist, they would definitely touch your breasts. Right. And then in some cases, especially in my case, in which they just want to make sure, you would definitely get an ultrasound.
Okay. So you used to keep on doing regular ultrasound.
Yes.
Then he advised you for an MRI.
Yes. Yes. So he told me just go for an MRI. So I went for an MRI, not thinking about anything. I was, whatever, I have to do this again. And then,
you were
but
prepared.
It's fine. It's not a big deal. And then that was the last day of my holiday. So then I came back to Dubai. And when I came back to Dubai, after 20 days, my results arrived. And the left breast, okay, the right breast was already estimated as BI-RADS 4C. I think that the doctor, Mohan, can explain a little bit more, but that means a very high percentage of...
Very highly suspicious areas.
Exactly.
So.
Yes. So luckily it was so early that it was a non-mass. For the first time that I learned that there's actually a non-mass.
There's also this variant called DCIS. Yeah, so I think that's what she had.
Yes. So I could not have noticed it. But at the same time, DCIS can become invasive. And there were actually 4 foci of invasion. Yes. It was ductal carcinoma in situ. Again, I have to admit that I was used to going to different hospitals, and I actually think I'm a religious person, so I think that it was God that brought me to Dr. Mohan, definitely, because the other doctors. So the minute that I received this result, for me it was okay. Alarm! You need to check with a proper doctor what is happening there. So. Yeah, so we had, I went to Zahra Hospital. They took me in immediately. What I liked about this was that it was very, very connected. So at no point I had my case doctor, Dr. Tagrid, and at no point did I have to pick up the phone and try to see, okay, what's the next step? What should I do? No, it's a system that is fully connected.
It was a process.
So imaging connected.
Just let me intervene here, sorry. So basically what happens is that the patient's diagnosis, as you very well know, is done by a breast surgeon, not by me.
Right.
So once Dr. Tagreed is one of the best surgeons that works in Al Zahra Hospital, and I do work closely with her. So when she sees a patient like this, and if it is a possible case for reconstruction, she will immediately communicate with me. And we give a priority appointment to such patients.
On right time.
So we see them early, and then there is of course the tumor board that makes the decision, partial mastectomy or total or whatever. Right. And those decisions are taken. And then I am a cog in the wheel or a wheel in the cog, whatever you say, in terms of doing the reconstruction bit. And there are many patients who don't go for a reconstruction, who are deemed as advanced and who just get their mastectomy done.
You already lose hope.
Yes.
I feel that's where
No,
her
it's not.
bravery
It's not. Today the treatment is so good that even advanced cases, you have neoadjuvant chemotherapy, which can downsize the tumor and then you can do the surgery. So many options are there.
Yes, but I think mentally they still affect, right? Mentally people
Absolutely.
get affected
Yes.
a
No,
lot. I think you can
absolutely.
explain
Yes.
how was the feeling? I mean, even though knowing that it was running in your family, how was that feeling? And how did you manage to tackle that alone?
Well, it was not pleasant, but I always use a lot of humor. I mean, life is tough, and I think that if you can't laugh about things, then they're just going to bring you down. So I remember I called my sister and I just told her, okay, I have good news and bad news. I told her, which one would you like first?
Her spirit was amazing throughout
I
the
can still
journey.
feel it.
Absolutely.
I mean, it's amazing.
She came as a very different person, and compared to the usual patients who are consumed by anxiety. Of course, I justifiably so.
Yes.
But she was. I mean, now I know the backstory more than what I knew before. So that kind of, maybe the family was a little bit prepared, having seen the grandma and the mother go through this. I think that made a big
plays a
difference.
very important
Yes,
role.
yes. I did see the other family members during her admission, and they were all so supportive. Yeah.
Yes. So I don't think that the family fully accepts it, especially that I'm the youngest. So there was kind of a meltdown in the family. But I think that again, the fact that I didn't seem to be so upset by it, I think that it changed. It made, especially my father, for example, it made him relax a little bit more.
It all
And-
radiates, no? I mean, whatever you
Yeah.
feel inside, the aura, it becomes as your aura and
Yeah.
you radiate that. So
Yeah.
probably having a positivity and all that spirit in yourself will
Yes.
keep your environment, it will take care of your environment on its own. You have to just take
Yes.
care of your own self.
Yes,
Right?
yes, it does. It does. And yeah, so what I had in my mind very clearly is that, okay, this is a problem, an obvious challenge, right? But like any challenge, we have certain factors that definitely play into our advantage. The fact that it's very early,
Yes.
the fact that, for example, in my case, there were no additions to my chest wall. The skin was not affected, the nipple was not affected. So all of these things that, thank God, were there. So, and thank God that we live in the year that we live in, right, where there are options and then there are doctors. And then coming back to the doctors, so the minute that I talked to Dr. Tagrid and then definitely to Dr. Mohan, he did take me in as a as an emergency case, and it was the end of his day. But he never rushed me. I think that he spent with me at least 45 minutes
Possibly.
explaining very, in a lot of detail what the options are, how big my scar is going to be, showing me photos, being interested in my lifestyle, because I think that many doctors, the problem that I see is that they just take you by the book, but they don't really. So what I always say is that they're treating the disease, but they're not really treating the person, the patient. It's a patient behind that. And sometimes, I know that the doctors want to help, but maybe sometimes the patient has a different level of, even of risk that they want to take with certain things. And it's fine to let them make some decisions. Okay, that doesn't mean that I'm encouraging that people that have cancer should not have the proper treatment. I'm just saying that, especially when you have the options, a discussion about the options is much, much better than anything else. Because I hated it when somebody came to me and told me, oh, lumpectomy, radiation, and then 10-year on tamoxifen. No. First, I don't want radiation because I think that is highly toxic. And why would I submit myself to this when we know that it can be fixed through other means? Then lumpectomy, why don't you even, think about the fact that, the size of my breasts are not big enough. What are we going to do? Just keep removing then.
Again and again, you
Yes.
keep cutting and removing the lumps, right? It's not
Until we
one.
destroy the skin, and then what is a good doctor going to do with that? So all of these things, I hate it when they just throw something at you and they say, that's the way that it is.
I think dealing
Yeah.
with the emotional aspect, especially in case of cancer, I mean, This is what I'm saying. Even if you're prepared, how much ever, it still requires a lot of empathy from the
Yes, it
doctors.
does. It
And
does.
there are
Yeah.
very few doctors, I'm sorry to say, who give time to patients. Somewhere the
Yes.
system is also a reason. You give 15 minutes
Time is a difficult commodity.
Yeah, 15 minutes
Because
time,
you
20
have
minutes
Definitely.
time
Yeah.
slot. Sometimes people might need
because
1 hour.
because
What
what
if
happens
2 hours? I mean, it's about
Yes.
someone's life.
Yes.
Give them.
Yes.
That's very important. And very rarely you find such people.
what happens
Lucky you.
well, what happens is that okay, slots have to be given for practical purposes, 15-minute or 20-minute. Otherwise, you will not be able to accommodate enough number of patients, and they will have long waiting lists.
Right.
Of course.
So what I like to do is any patient who has this kind of a diagnosis, cancer diagnosis, or a difficult condition which requires a lot of talking to, a lot of concepts to be put across, I usually tell them book that patient as the last appointment. Or maybe I'm able to spend only 15 minutes with them, but tell them, look, I need to spend more time with you. If you have time, wait until I finish my clinic, then I'll take you up and then we will have a good chat. Or fix another appointment at the end of the day on my next, OPD day. Because I usually call them at the end of so then I don't have a time constraint. I'm not, taking another patient's time. Nobody is waiting, so nobody is upset. So I can devote time, because once in a while, I mean, how many cancers? I'm not going to get cancer patient every day for reconstruction. So this may happen once or twice in a month. So give them the time so that they have all this information to make a decision. See, because reconstruction for breast, that's where I come in. There are so many ways to reconstruct. So we need to know, like, this has these possibilities and these risks, and this technique, the possibilities, merits and demerits, and the time taken and the cost and all those things. Right. So then let the patient's input also come in so that we can take a decision that is acceptable to her.
Right.
So
and it has to be a to and fro
it has to be.
communication.
It has to be.
It cannot be just like, okay, this is what you have to do, and then khalas.
It has to be.
like
It has
that.
to be. And
That's
plastic
very
surgery, as we discussed last time, there are always, for one problem, there are multiple options.
Yes, true.
Yes. So then I think that we had a second
Yes.
consultation
For sizing.
for
and-
sizing and so on. Again, he booked me in his lunch break, and I felt so bad afterwards that he told me that he had his lunch break. And I think that he
Looking
spent
add
with
on to
me
that.
like 1 hour and 15 minutes on that occasion. So even longer. Again, although he had explained to me, because I think that Dr. Mohan understood the fact that first time you're a bit shell shocked.
Things don't go in. Things don't go in. Yeah.
So he explained to me again in full detail that the procedure that we had decided upon, which was prepectoral, so not under
Under the muscle.
Yeah, under the muscle, not disturbing my chest muscles. And then it was a discussion about implants. And again, here, I'm not really sure how the other people, but sometimes I see in my in the support group for cancer patients, there are some women that are afraid to ask questions, and I say, I didn't know that the doctor would is supposed to give you more options or whatnot. I think that we actually live in a very privileged time
I
in
think
which
here
we
the
have
doctor
options
plays
for
an
so many
important
things.
role, Andrea. I feel doctor plays an important role because you have to make patient that much comfortable that they land up asking questions.
Yeah.
You have to open that doors that they talk to you. You have to understand their emotions, especially in
Yes.
case of cancer. It's not just a simple implant.
Yeah.
If it's a cancer patient, you have to understand what the person is going through, how comfortable is patient, to go through a certain procedure.
Absolutely.
Yes.
That barrier
Yeah.
has to be opened. It's not always the person who is wrong. I'm sorry to
Agreed.
say.
Yes,
It's
I
also sometimes the doctor.
agree.
They have to open those gates that they talk about it openly.
Yes, I always say that. Present the options. Let them, if they need more time, let them decide.
Yeah.
There's no, there's a time limit
are
to how
important
much
decisions, so you
it's
give
an
them some
important
decision.
decision.
Absolutely.
Yes.
So what was exactly the procedure, Dr. Mohan? How
Well, so to sort of summarize what she had undergone, so on the right side, she had a cancer diagnosis, but the left side was not involved. But because of the strong family history, a decision was taken that the left side breast also be removed. But then today, that's a brave move. But then removing the breast is in a prophylactic way. This is called prophylactic mastectomy. We preserve the skin, we preserve the nipple, we only take the breast tissue from inside out. So you have the envelope. Now, using an implant, we can reconstruct that breast.
So complete the
So
ductules and the everything.
everything is removed.
Okay, it's just the covering.
We have the skin cover and the nipple,
Okay.
and even the tissue behind the nipple we remove to the extent that it will not affect the blood supply of the nipple.
Right.
And then you place an implant either in front of the muscle or you lift the muscle and go behind the muscle. In the past, it was standard to go behind the muscle so that the muscle is in front of the implant and gives more padding.
Okay.
But today the implants have improved and the technique of prepectoral has become quite popular around the world. Here we like to add a what is called a ADM. So dermal matrix, acellular dermal matrix. This is synthetically produced skin-like substitute.
Okay.
So you wrap the implant with it because what happens, a silicone implant just under the skin doesn't feel good,
Right.
and it doesn't get proper adhesions, and the quality of the reconstruction is suboptimal. And
you couldn't do fat grafting
even
in
you will
these
feel
cases?
the coldness of the implant. Yeah, fat grafting can be done subsequently. So prepectoral implant with fat graft subsequently, yes, that works. But the implant has to be covered in a mesh. Okay, so that's the current thought and the current
called
standard of.
again?
So ADM, acellular dermal matrix.
Okay.
Now there is a type of implant which is coated with a PU foam, polyurethane foam. So it already has the coating. So then we can skip this ADM. So that's what Andrea has.
Okay.
So I decided to use
also
an
called
implant.
the NASA breast.
NASA breast. Why so?
NASA breasts now.
No. This implant is made. It's a lightweight implant, 30% lighter than other standard implants.
The white one.
The white one, and then the gel inside is got some microspheres which reduce the weight because the spheres are almost weightless. And this technology has been adapted from NASA research, where they have the astronaut suits which have to be very light, so that it doesn't add to the payload weight, yet provide insulation to the astronaut. So that kind of a technology has been adapted into breast implant. So this implant is lighter. It's got a different feel. It's more doughy feel. But there are two variants. One is like this, and one is covered and coated with polyurethane foam. So the polyurethane foam encourages nice adhesion between the undersurface of the skin, the inside of the skin, and the implant. So once you place the implant, it stays where you place it, and it integrates with the skin. So when she feels her own breast, it doesn't feel like there is a separate silicone ball rolling around. It integrates. So that integration is very good. And even though it's not yet 1 month, it will be 1 month tomorrow. Already the look and feel is very natural. And she doesn't.
not yet 1 month.
She doesn't miss. No, she goes into sleep with a normal intact breast, wakes up from sleep with again normal intact breast, look alike.
And you just got rid of that fear,
Yeah.
right? That
Yeah,
was
and-
constantly in your mind for so many years.
So the gland is out, so her risk for getting cancer in the other side is drastically reduced, almost 99% reduced.
Yeah, and I think that was. So I have to admit that before, if apart from the shock, right? Because you're not feeling unwell, you don't have any kind of symptoms. You're just looking and thinking, how come there's something inside me that can kill me?
Yes.
So I think that first it's that
Yes,
shock.
yes, that's right.
And I actually read a research that says that a lot of people that discover cancer in very early stages, they say, maybe they're wrong, or maybe I have many more months to wait.
Rejection
And-
is the first phase, right?
Yes.
Yes.
You don't
Yes.
accept, how come this can happen to me? This is something wrong.
Denial.
Denial.
Denial
Yes.
phase.
Yes. And apparently there are quite a lot of people that wait until it becomes invasive and until it's difficult to treat and so on. And, while I was having these thoughts, it's true that I was looking at my own breast and I couldn't believe it. You guys are betraying me.
Yeah.
We've had a long life together and now you're turning against me. And I think that psychological factor. So I think that would have been the scariest thing. Although I've seen my mom and my mom didn't really have reconstruction. But to think, what if I just wake up with nothing, I know that there are women that prefer to have a flat chest. But I think that as much as possible psychologically, it helps so much to have a reconstruction. And in my case, I wasn't really aiming to change the size or anything. They literally look 98% like what I was born with. Yes.
See, this
So
is
it's
acceptance
amazing.
is one thing. Many people, they accept it. but many people, they want to look the same. So it's individual call. I mean,
Definitely.
and then how you can, when we have options and we have experts, why not to go for it? I mean, you can just be yourself again. So ultimately, it depends on a person's mindset if they want to just accept it and be with that flat chest, or they want to,
Of course.
love and want to be back to those curves. I mean, what is femininity all about, right?
Yes.
And
yes.
then having an expert like this who can really bring things back to natural and normal, it's amazing. I mean, I think people should go for it.
Yeah. So basically, any woman who gets this diagnosis will have two fears. One is, of course, fear for her life. Who's going to look after my children, etc., etc. Responsibilities, all that comes up,
Right.
and then the fear of losing the breast and losing the femininity and body image.
Absolutely.
So the possibility for good quality reconstruction, it has to be a good quality reconstruction.
Agree.
Yeah. So possibility that you can have a good reconstruction, and seeing some pictures, and that knowledge allays that one fear that, okay, I'm not going to lose my breasts. I'm going to look almost the same as, at least in dress, I'm going to look the same. And even without dress, in some early cases like hers, she will see no difference before and after. She looks
Believe,
exactly
Dr.
the same.
Mohan, I'm telling you. I mean, I'll just be very honest. I have also in my family, cancer running. It's cervical cancer. In my maternal side and even dad's side, many people in family, they died due to cancer. Even I mean, few of them have done cervical conization because of early diagnosis
Yes.
as well, because we keep doing the checkups regularly. That feeling itself, I mean, it's my very close niece, she underwent this procedure just I would say 42 years old. And she was like, even if it, Anita, even if it is inside my body, I can all the time feel it, that something is missing. Something has gone out of my body. I mean, cervix, because it's all what makes you feminine, right? Then losing the breast, which is it's external, it's your appearance, which makes you more confident.
I think many people don't verbalize all these anxieties. They keep
Yeah.
it inside. And in the limited time that they come to the hospital, and it's mainly focused on the medical aspects,
Right.
chemo first cycle, second cycle, whatever, mastectomy done, how does the wound look, and so on and so on. So there is a big role for a counselor in any breast team, a counselor who's mature, who has experience, who has empathy, somebody who is not so pressed for time, because doctors, ultimately, we have to accept the fact that doctors are forever pressed for time. Because if you give huge time slots to each patient, then there are only so many hours in a day.
Yeah.
You will end up seeing less patients. So less patients you will end up seeing, so the patients get longer and longer appointment. That will upset some people. So it's very difficult to find the balance between giving enough time to patients and being able to see enough number of patients in one OPD session. It's always a difficulty. So here is where, for those cases where more time is needed, you need to make some sort of an arrangement so that you can explain these things. Again, the slots and then the monetary aspects of it, the insurance, remuneration, and each slot from the business end, when the hospital looks at it, if the doctor is only seeing 3 patients, he's not bringing in any revenue to the hospital. If he's seeing 10 patients, there is revenue coming in. So all these factors are real life factors. We cannot wish them away.
cannot deny
We cannot wish them
Agree.
away.
Yeah.
So, but out of the 10 patients that you see in an OPD, maybe 1 or 2 need more of your time. And you start spending more time with them, 3 more patients are waiting outside, and they get very angry because everybody's time is important. So to find this balance is not easy. This is one of the biggest challenges in running an outpatient clinic. So I generally tell the patient, okay, look, I need to spend more time with you. I cannot do right now because your slot is over.
Come at the
So
end of
come
the
at the end of the day. Well, then
We'll
that
sit
case,
till the OPD closes for you.
of course, it takes my time,
Yeah.
but it's okay. It's okay. You go home half an hour later.
Yeah,
It's okay.
true, it's okay. But I want to understand, Andrea, from you, if you would like to share what was that one thing that kept you going and kept you motivated, that I want to fight this. It's okay if I just prophylactically remove one of the breast which is not affected at all. What was that one thing which kept you going strong-headedly, that I'll face this, because you were all alone, handling all this chaos?
Yeah. So I think that on the one hand, it's definitely fundamented on your own view of life and your own beliefs. So that's very important. And in my case, I'm a practicing Christian with very strong beliefs, and I knew that God was in control. right? And if somebody that is much more powerful and wiser than you is in control, then of course you need to do your part.
Absolutely.
But there's no such thing as making such a bad decision that, the most powerful being in the universe would say, oh, she caught me unawares. I wasn't really sure how I was going to react to that. So that gave me a lot of comfort. So then I knew that, okay, I have these options. In my mom's case, it was contralateral. It's very likely that in my case, although genetically, by the way, genetically I'm clean. But it's just one of those things, right? So although I knew that it has a high probability that it's contralateral, and I didn't want this headache. So the years that I've got left, I don't know how many or how few, but I want to live them with a certain sense of relief.
Yes.
That at least what was in my power was done. Because that's the only thing that we can control.
do
What's in
just
our
our
power,
part.
right? So in my power, it was definitely to have them, to have the prophylactic. Yeah, surgery on
Gives peace of mind.
the left
Prophylactic
side.
mastectomy gives peace of mind that the other 50% with an identical risk actually, because genetics affects both sides. Affects both sides.
Yes. And
So more and more prophylactics are being done now, especially because the diagnosis is picked up early. We have the genetic testing, and then we pick up those people who are at higher risk, and then a prophylactic is offered to them. Especially so because the threshold is a bit better now or less now, because earlier, if you recommend somebody for a prophylactic, obviously she's going to be concerned about the cosmetic outcome of the reconstruction. Now, since the reconstruction has reached a high level of perfection, therefore prophylactic is more easily recommended. And here there is no radiation involved. See, her cancer was early, so definitely there's going to be no radiation. And in prophylactic, there is no radiation because you're taking it out before the disease. So the thing is, radiation is a double-edged sword, like we discussed last time. Of course, it is essential to control more advanced cancers, but unfortunately, it does a lot of damage to that area.
Oh, yes.
And then the reconstruction becomes more challenging. If I do the same reconstruction, what I have done for her, but if there has been radiation, then the capsule that forms around the implant is hard and the breast is not soft. Everything goes hard. So this is where, I use fat grafting to soften it up a little bit, and fat grafting comes to the help. There, of course, we go for natural tissue reconstruction at a later stage. If this tissue becomes too hard, then we need to use tissues rather than implants. So there was a period of time when reconstructions were done with implants, and then the pendulum swung towards tissue, especially in high volume centers where there are good team of plastic surgeons and they can do autologous tissue reconstruction. Even today in many centers where autologous microvascular reconstruction is very commonly done, which means taking tissue from the abdomen and transferring it to the breast and attaching those blood vessels under microscope. So you can reconstruct a full breast. That is now the gold standard. That breast, from a flat chest, you can go to a full normal looking breast, which is soft, made of own tissue, warm, everything. But that requires a team, it requires a lot of expertise, and it's also a risky procedure. If it fails, it can fail totally. So implant is a simpler option, right? So the implant did not give very soft and very good looking breasts, but that has changed now with the prepectoral, with the ADM mesh, with the addition of fat grafting, especially in those cases where there is no radiation. So the pendulum is again swinging to the middle so that the implant-based reconstruction and tissue-based reconstructions both are in vogue. So we pick and choose in which patient we want to go implant-based and which patient we want to go tissue-based. And again, it's not this or that, it's a continuum. For example, we can do with an implant in the beginning, let's say even an expander, and do an implant-based reconstruction and follow up and see if things are not satisfactory, we can go to the tissue. So the tissue-based reconstruction is kept as plan B. So plan A would be to use an implant. Now in her case, what we have done is called direct to implant. If you do the mastectomy, you put the final implant. Done in one stage. That is called DTI, direct to implant. But more commonly, the mastectomy is done. Maybe this person is going to get a radiation, maybe not. We don't know at that point in time. So we put in a expander. And here, all the skin and nipple is intact. In many cases, the nipple and part of the skin is removed in a more advanced situation. So we have less skin. We need to expand that skin. So we put an expander. So it's like a silicone implant, but empty. So we can go on filling that with saline, and it blows up like a balloon gradually, and then you get more skin developed over the next 4 months. And then we can place it. At that point in time, we can either go for tissue or we can go for the implant. We usually go for the implant.
Prophylactically, it's so much better,
It is.
right? It's
Agree.
so less aggressive. I mean, I can say it's making me sound that she has got rid of so much of suffering at a very early
But it is for
phase
it is for
because
people
of
who have
early
a high risk.
diagnosis.
High risk. High
Yes.
risk.
It's beautiful. But then there's a myth that implants, like who are prone to have cancer, breast
No.
cancer, they
This has
can
been proven.
increase the risk of cancer.
No, absolutely no risk. So this has been proven time and time again that breast implants are not associated with the risk of breast cancer. For example, somebody who's just getting a breast augmentation done, she has her own intact breast tissue. So her concern, of course, natural question many of them ask is, can this promote cancer development? So the answer is no.
Any
This has
of
been-
any of the implants.
any of them. So this has been studied again and again. But then we talked last time about what is called the ALCL, which is a rare cancer, not of the breast, but of the lymph nodes, which has been associated with a coarse type of implant, an implant which has a coarse texture.
Surface.
Yeah, nowadays we are not using these coarse textured ones. We are using fine texture, micro texture, or smooth. These are not known to be associated with this rare condition called ALCL. And the coarse implants were also from a particular company. That company has now discontinued producing implants. Somebody who has those kind of coarse implants, if they are worried, they can come for a change of implant, and that's simple.
So this can stay for like forever.
Her implants are special. They are the latest ones, and these can stay for a long time. I mean, the company says it can stay forever, but I would say 15 years, and keep checking after that. If there is any spot of trouble, change it. But for all intents and purposes, according to the company literature, this need not be changed. These particular implants need not be changed.
So how important do you think, Andrea, it is that people should get their checkup done? How much they can really get away from sufferings?
I think that it's very important. The pain that I went through, it was minimal, and it's incomparable to the pain of a body that needs to be submitted to high toxicity, high radiation, and just
Major
gets
surgery, more
messed
major.
up, major surgeries. I've seen that in my mom. My mom had glioblastoma, and that's how she passed away. And I know how all these treatments ravage the body. So I would encourage everyone, because again, I had a lot of friends, some of them that said, okay, I'm going to get checked up. And a lot of them that said, I'm not going because what if they discover something? Well, now's the time to discover it. Not when you do not have any options. Not when you do not have any options, because when you reach that point in which you submit your body to so many treatments and they're so horrendous, what a lot of people do not know is that there's 40% of the patients that actually die from the side effects of the treatments, not only from the disease. So there's such a fine line because there's a lot of toxicity. So the earlier that you can identify a disease like this, a cancer, by all means, identify it, do your checkups, any kind of worry, just go and sit down with a doctor and do your ultrasounds, MRIs, mammograms, whatever is required, just do them. It's going to take very little of your time, very little effort from your side, and it's going to give you peace of
It's
mind.
widely available.
Yes,
And these things are
exactly.
widely available. There is a clear pathway. There is a triple diagnosis from the radiological point of view, clinical examination, and biopsy. So everything is well established.
People just they want to ignore
So
the
it should be.
the fear of facing
Yes.
it, but they don't know that they will land up in a bigger trouble if they keep ignoring it.
Of course.
I mean, see,
course.
the reason, I have seen so many cancer survivors, definitely they go through a lot of complications and
Yeah.
sufferings because of radiation and long-standing treatment and then metastasis, a lot of stuff, as you know. But then somewhere they chose this journey. I'm sorry to say, right? Maybe they ignored it. They didn't pay attention to those small signs and the symptoms.
Yeah.
And they chose it, but you chose to take an early action and get rid of those sufferings. So
Yeah.
that one wise step will keep you away from all these sufferings, and that's really possible.
Yeah,
right?
to be honest, with respect to breast cancer, there are usually no symptoms. So even if there is a lump that is felt, the lump is not painful. So it starts with self-examination, and I think here,
there's no pain.
here I can talk about breast self-examination, which has been widely published already. Many women know this, but again, in the first week after her periods, a woman should follow. And in the internet, you can find the technique how to examine yourself. Have the hand behind the head, have a little pillow under the shoulder, use your flat of the other hand, systematically feel all the quadrants, look at yourself in the mirror, put your arms up and look again if some part is getting retraction. All the steps are there, easy to find out, easy to learn. So I urge every woman to do breast self-examination in the first week after periods. Why first week after periods? That's when the breasts are softer. So many women, their breast becomes more firm, more nodular 1 week before period. So that's not a good time to examine. It'll be confusing. So the week following periods, the breast is in its best, softest
1 week after the period stops.
Periods finished, and the 1 week, within that 1 week, say the following day, let's say. So make it a routine, write it in your mobile to remind you. It takes 5 minutes.
True.
Yeah.
And if you do that every month, you know what your breasts feel like every inch. You know it from your memory.
Absolutely.
So you would be more sensitive to pick up something abnormal.
True.
And the woman can feel it with her finger and feel it internally in her own breast sensation if there is a lump.
Right.
Okay. So in fact, in one of the school students' project, there is a girl that got the first prize for making a model to teach people how to examine.
Really?
Yeah. So
how
she
does that work?
so she made a breast-like thing and put a marble inside it, and with different size marbles, you can feel it, and then whether you feel that lump or not. That's sort of just simple teaching aid. High school project.
Right.
High school project.
That's wonderful.
So that's what you have to do. And if your self-examination reveals something, go fix up an appointment with the doctor,
Exactly.
get your ultrasound. Apart from this, annual ultrasound. Apart from this, it used to be mammogram, but now mammogram also gives radiation to the breast. So in the majority of cases, you don't need to do mammogram every year. You do a mammogram and ultrasound after 40 one time, and then the mammogram, depending on the risk stratification, can be done once in 5 years. But the ultrasound is done annually, or if there is any suspicion.
Okay.
And if that is so, something is picked up, there is a targeted biopsy under local anesthesia. A needle is placed under ultrasound guide. A bit of tissue is taken, looked under the microscope, and then that will give the diagnosis. Or if there is anything more suspicious, further investigations may be ordered. So the pathway is very clearly laid out. Most of the bigger hospitals and centers and clinics, they have this in this country. So there is
There
no
is
reason.
also a myth.
There is
I'm
no
sorry,
reason
Dr.
why a woman cannot find
Right.
this.
No, but there are so many fears in people's mind. I mean, I'm just putting across few myths.
Yes.
Ladies feel that putting a needle in the nodule and aspirating the fluid might spread it more.
No,
So most of the
that is
times
not
they
true. That is not true. The needle track. Yeah, this has been discussed. This has been discussed many decades back. Whether doing a needle biopsy, is there any spread of malignancy? That has been disproven.
What about the females who don't breastfeed and they
And by
have
the
a
way,
little
it
bit-
doesn't hurt. I've had many biopsies done, fine needle aspiration as well as vacuum assisted biopsy. So it's basically a device as thick as as your little pinky. It does not hurt. Afterwards, of course, the breast tissue suffers, but on the moment is literally just with a little bit of spray and you get poked with it and you're not.
This is needed for those for the
For the suspicious area. For the
Yes,
suspicious
yes.
For
area.
Yeah.
people who are just scared of needle, I think this is needed for
Yes,
them.
it doesn't
No.
hurt. So they should be at ease and just focus on, I don't know, I like focusing on the screen, on the what machines the doctor is using. I like it when the doctor explains to me what they're doing.
I can notice that because whatever Dr. Mohan is explaining, you're nodding. The way you're nodding, I was like, she already knows all this stuff.
She's a very
you know?
positive person, and she has more knowledge also, so that helps.
Yeah, it helps reading. It helps reading, and that's also something. So apart from self-examination, which yes, I would encourage. It takes a minute in the shower, before you shower, in bed when you lie down to sleep, because the position is just so that it helps. But also to read a little bit about your condition. People tend to feel scared. They think, oh, there's so many medical terms. Yes, some you will not understand, but others you will definitely understand once you start going to the doctor, for a set of tests and analysis. So by all means, read about everything. I think that the more information you have, your mind is at ease and you might feel like you have a little bit more control. And I think that that's the problem. That's
At
why
least there is
people.
a question, right? At least
Yes.
there is a question. I mean, this is also a reason of, a purpose of my channel, because I bring medical practitioners. I mean, they're all
Yes.
doctors. They talk about medical terminologies.
Yeah.
I understand most of the part, like people don't understand, but at least they hear it. They can find out, okay, what is it
Today
all
it's
about?
possible. Today it's possible. You
very
look for the
Education,
meaning.
educate
You look for the
yourself.
meaning in internet, and then you get the meaning.
Exactly. So that constant hammering and understanding that you can read about it and be
Yeah.
aware, so that when you go to your doctor, you can ask 10 more questions rather than just sitting and understand, okay,
Exactly.
all right, and just being a layman and
It
accepting
has.
whatever it is.
There's also a flip side to it. So she's able to process the informations very well, but there is also a flip side because people get freaked out, and then you know very well that Dr. Google diagnosis.
Oh, yes.
And now there is something called idiot syndrome.
What is that?
Idiot syndrome. I hope I remember the exact expansion for it, but internet derived information obstructing treatment.
Yes.
Internet derived information obstructing treatment.
Oh.
That's an idiot syndrome, because a lot of patients do a lot of reading and then they just take it as black and white without understanding the context in which it has been said. And you're a doctor, I mean, medicine is not easy. 2 and 2 can be 4.5. 2 and 2 need not be 4. 2 and 2 can be 3.5. So the context, the whole patient, examination, everything determines your diagnosis, and the common things are common, rare things are rare. All this goes into the doctor's, thought process before he arrives at a diagnosis or gives you an advice or whatever. But if you read on Google, then you get a bit confused. So it's all right to read, it's all right to process the information, it's all right to ask questions, but it should not lead to obstructing treatment. And objecting to everything that the doctor is saying. Then it becomes very irritating.
I mean,
And
you
then
can
you are
take
denying
opinions.
yourself.
Exactly.
You are harming
Escaping.
yourself. No, you are harming yourself because you become obstinate. For everything you say, but Google says, but I did the research here, but I read here.
Annoying.
So it becomes annoying and it becomes obstructive. So then,
Idiot syndrome.
yeah, so that's called idiot syndrome.
Yeah, that's a very good one. Yes. And I'm pretty sure that it exists.
How does mental well-being play? What role mental well-being plays in terms of dealing with such situation when you come across?
I think that it's super important. So, okay, I think that there's one concept that has to do with everyone's capacity to deal with the unknown. Because at one point there is going to be an unknown. And I'll give you an example. I've never been through any major surgery, right? I had never been put under general anesthesia. So I had reached a point in which I just couldn't remember beyond the 13th of October. I not remember, but imagine what life would be beyond the 13th of October. I only had the trust in the doctors because they put me so much at ease that I knew that I would be, from that perspective, I would be well taken care of, right? And then as we talked about, it's important to have some sort of basis in your life that goes beyond only, let's say somebody's skills, right? So I think that the two go together. Yes. And then your ability to deal with the fact that, okay, I do not know the 14th of October, but it's fine. As a matter of fact, I do not know the 10th of November either.
Yeah,
to be perfectly true, to be perfectly honest, right? But then I know that, whatever comes, there are things that I can still do. I can in due time go back to work, that on the 14th of October, I need to start eating well. I need to
one
start
step
getting,
at a time.
exactly.
Take one step at a time.
Exactly.
Yeah.
Take one step at a time. And that's what I mean by dealing with this, this uncertainty. No one can guarantee you anything. for all they knew, I could have had like a whatever congenital heart disease. I could have died, right? But I knew that at the same time, if I woke up, there were things that I wanted to do. There was Oktoberfest coming up. I love Oktoberfest.
Yeah.
Yes, and I'm not saying plan for those things, because planning with such a diagnosis is difficult. Even now, it's difficult for me to think, okay, I'm going to go on holiday somewhere next week, next year, actually. I can't really plan for that, but I know that there's so many things that I can think about. For example, this morning, just the fact that it was my first workout session after the surgery. Isn't it amazing that, yes, I am a bit out of breath. I do have limitations on the exercises that I can do, but isn't it amazing that this body still functions properly in most of its areas?
Yeah, you will get your fitness back soon. Yeah.
Definitely.
Yeah. See, I think one of the things that also helps in the early period is pain control. And I take a lot of attention to give them good pain control. Preemptive analgesia. So I use long-acting local anesthetics before even starting the surgery. So that helps a lot because, patient wakes up, doesn't have much pain. Already half the confidence is there.
Definitely, yes.
Okay, it's not been so bad. I've recovered well. And I remember in
was
the evening when I came, I was impressed with her and she was impressed with the surgery. So it was. So I said, "Have you had surgery really?" She said, "Doctor, I don't know. I don't feel like I've had surgery." So. But then your family was great. I mean, your sisters were there. And there was a gala atmosphere in the ward, which was again a pleasant surprise to me, because in the evening when we go, usually there will be hyper anxious people, hyper anxious relatives. But here everybody was so cheerful, and it was like a birthday party going on in her room on the very evening of the surgery. So that was
first
very
I told
amazing.
them, don't just wait here around fretting your hands. Go and have a proper lunch. I'm paying for it. When I'm done, come back. And I think that was important. And the fact that even the days leading up, so on the last day, I went out with my sister. I put a nice dress. I thought, okay, even if I die, I'm going to be the most...
Start valuing little things in life, not small things in life.
Exactly. To my favorite restaurant, doing the things that I enjoyed. And again, afterwards, and I told them even in the morning, just don't start crying and whatnot. It's not the moment to freak me out.
She's really a strong lady. I mean, trust me, all the time I was feeling like, should I grab a bottle of water? I mean, she was feeling emotional, but this is amazing. I mean, you're an inspiration.
Thank you so much.
Wow.
I don't really intend to be an inspiration, but I think that life is anyway difficult. So why make it more difficult by fretting?
Yeah, true.
We're lucky that there is a solution to this issue.
Absolutely.
So at this point, there was a solution. So then why fret and keep thinking, feeding, even now, as I said, so with this diagnosis, they never really tell you you're cured. They only tell you you're cancer-free at this point. But you never know when your wacky body starts copying cells wrongly again and they start building up somewhere else. But at the same time, live every day.
Absolutely.
Live every day. It was very clear for me that I was not going to just crawl into bed and cry. That doesn't mean that I didn't have an emotional response. It's not nice the first time that you see it. It's not nice. And I remember that even Dr. Tagrit, she was very worried, and she told me, "Can you come in now because we received your tests? We'd like to discuss them." I said, "It's okay. I've seen my tests. I already know." So tomorrow, let me. It was one of my friends' birthday parties. I said, "Now I'm at a birthday party. I prefer to enjoy this. Tomorrow we'll come and we'll discuss about the solutions." And she told me, "Okay, that's fine."
Wow.
Yeah.
Beautiful.
So it's solution oriented. And then one of the things that we tend to associate pain with a bad thing. And actually some time ago, I read many years ago, about the importance of pain in our life. Not only medically, because it alerts you that something is wrong in your body, but then pain is also good for growth. So okay, I wasn't really planning on that, but maybe this one, whatever I have, is here for a purpose. It's for growth. It's exactly like in the gym. in the gym? Is my trainer secretly hating me when he's telling me, no, you need to finish two more. Is he hating me? No, he's not hating me. On the contrary, that is for
your betterment, for your
exactly. So if you take that, if you think about
stronger.
life in that way, yes, it definitely makes you stronger. And then so what I liked is that literally whatever Dr. Mohan told me about the surgery before, it literally happened. Wow. He told me that evening, you're going to have to get up. He came shortly after, made me get up. Everyone was like,
made you walk around. Yes.
Why is she getting up? The fact that he told me that there's not going to be that much pain, fully, after 3 days, I didn't even have to take any pain medication. Not even like a Panadol. There was no need.
Yeah. It was pain-free?
And I think it could have been even earlier, but just because I was still in the hospital, they were feeding me through the tube. I mean, they were giving me IV, but no.
So one of the advantages of going in front of muscle is pain is less. Because when you lift the muscle, then they tend to have more pain. Right. So prepectoral is more comfortable.
Yes. So literally everything went by the book. We were obviously afraid there's always side effects. So we were, making sure that everything was getting a good color. I know. In the best of hands. I couldn't speak more highly of Dr. Mohan. And again, what I wanted to say is that the minute that you were the first surgeon to see me after the surgery. So all my friends and my sister were there. So after you left, they said, "Oh, you're in good hands," because the way that he gave instructions, that he told me this and that. Oh, they disabled my AC. I was in a.
We want the room to be a bit warm.
Yes.
These reconstruction cases, because the skin circulation, because we have taken out the entire breast tissue from below. So all the blood vessels coming to the skin, I mean, many of them have been removed along with the breast.
Yeah.
So the skin envelope in a cold environment, the blood vessels constrict. And so we are concerned about flap circulation. So we need to keep the room warm, make sure that they drink enough fluids. Basic precautions.
Yes.
Wonderful.
And by the way, one of my good friends, he's a pediatric cardiosurgeon. When I told him about my entire experience, he told me it seems like you had a very, very special doctor, because he says that's what, like heat therapy, or maintaining a person in heat when the body needs to start working in certain ways. That's what's always recommended. So definitely by all means. And an amazing experience, although I hadn't really asked for it for this year.
You said all yourself. I was about to ask in few words if you would like to say anything about the overall experience with Dr. Mohan. But you said yourself it was
amazing. So at this point, I wouldn't doubt recommending him. I wouldn't doubt if he told me you need to go under the knife again at any point.
It should not happen.
It should hopefully. Yes.
It should not happen.
I know,
but we have a program of doing some fat grafting to improve further.
Yes.
Few months down the line,
Looking
we can
forward to that.
improve it even more with fat grafting.
Wonderful.
Yeah.
But it looks perfectly natural. It feels like a normal tissue, so it's warm to the touch. I have quite a lot of feeling, and I think that's
It's gonna improve.
Yes, that's going to improve.
In the next 4 months, you will get back much of your feeling.
Yeah, which was one of the worries. So everyone had warned me in the beginning. So
Again, fat grafting helps. I've had many women voluntarily tell me that now my sensation is better. Those that didn't have sensation in certain parts of their breast skin or the nipple, when we do fat grafting, So this was actually unexpected advantage, but it looks like the fat acts as a pathway for the nerves to grow from the periphery, regrow into the supply area.
The sensation.
Yes.
Wonderful. That was such an amazing time with both of you. It was great having both of you. Honestly, I'm so obliged and I'm honored that you were able to share. You took out your time.
Of course.
It's not even a month, to share your experience. And I hope our listeners, they get a bit of awareness out of this session that early acting and not escaping is actually what is most
100%.
important. early
So
step.
as I said in the beginning, hope for the best, prepare for the worst.
Yes,
So
yes,
if
you have
you're
to be mentally
prepared, if you are prepared,
rather than
then
escaping, and you
things
get
yeah.
in worse situation rather.
Yeah.
Yes, and I would add, go with a doctor that you trust, and by all means, do not neglect the plastic, the form, not only getting rid of
The
the
tumor.
beast.
True. Trust me, he's third time he's coming on my show. I mean, I'm invited him,
Yeah.
and I'm so glad and thankful to him that he takes out time to come on my show and talk about all this. The reconstructive aspect of plastic surgery.
It's amazing.
Amazing.
Yes, I can't
It brings
recommend it.
smiles on people's
Yeah.
face. Wonderful. Thank you so much once again
Thank
for
you very
coming on my
much.
show. Thank you so much.
Thank
Dr.
you.
Thank you.
And thank you for
Thank
coming,
Thank you.
Andrea.
Oh, you're too
Lovely.
far.
Thank
We'll
you
get
so
up in
much.
there.
Yes.
Thank you. Thank you so much.